Okay, so I'm going to be doing my head to toe assessment, and my name is Laura. So before coming into the room, I'm making sure to do hand hygiene, and I'm going to check for any tripping hazards on the floor. It's safe to enter. I also want to check my emergency equipment, my patient presentation. Their skin tone is good, no paleness or blueness. They don't appear to be in respiratory distress. I see even chest movement. And for my emergency equipment, I have my oxygen ready, my section's good, I have my proper tubing, and I just want to make sure that it's in working condition, and I have my ambu bag ready if I need it. So I want to make sure to verify my patient, and by the way, I'm Laura, I'll be your nurse. I'm going to be doing just a physical assessment. I know you just had some surgery, but do you mind just telling me your name and date of birth?
Yeah, Destiny Curiel, 12898.
Okay, and what brings you in?
I had surgery for appendicitis.
Okay, and I'm going to raise your bed.
Okay.
Do you know where you are?
At Grossmont.
Okay, and do you know the date and year?
It's 10/13/22.
Okay, perfect. So my patient is not slurring their speech. They sound clear when they're talking, and they appear awake and alert ×4. So I'm gonna start. I'm just gonna work my way down. I'm gonna start at your head. So I want to make sure to look at my patient's head. I'm just looking for like scars, dryness, any wounds on the head. And if you can just go ahead and look up for me. And I'm looking for JVD, tracheal deviation. And then I can perform my Perla assessment. You can look back down. So I'm just checking that the pupils are equal, round, reactive to light, and able to accommodate. So here I want to look for consensual response on the pupils. I'm checking both eyes. And one more time. Okay, and then now I'm going to check for their ability to accommodate. So I'm going to bring the pen towards you and then back. So just look at it. And as I bring the pen further, I can see the pupils are dilating, and then they're constricting as I bring it forward, and her pupils are round as well. And actually, I'll keep this out because I'm gonna look at your mouth. If you can take down your mask and just stick out your tongue. And I'm looking that the mucous membrane isn't too dry. It's pink, and I don't see any wounds. And then I can also check for facial symmetry. So if you can puff out your cheeks and stick out your tongue. Oh, I have to do that. Smile and raise your eyebrows. Okay. So facial symmetry looks good. Any changes in vision or sight, hearing, difficulty with taste, or ringing in your ear, nosebleeds, neck stiffness?
No.
Okay. So I'm gonna start by listening to your heart and lungs, and also I would want to take vital signs. So I want to make sure to take blood pressure, heart rate, respiration rate, temperature, oxygen, and I also am actually going to do a pain assessment before I do the heart and lungs. So right now, are you in any pain?
Yeah, I have a little pain on my right side.
Okay. And on a scale of 0 to 10, how would you rate your pain, with 0 being no pain and 10 being like the worst pain?
About a 4.
A 4? Okay. And what's your tolerable pain level?
A 6.
A 6? Okay. So just make sure to let me know if it's getting like unmanageable for you, so we can help you get that under control. But as for the pain, when did it start?
The pain initially started a day ago before my surgery, and then it was okay after my surgery, and within the last hour it started to hurt again.
Okay. And where is your pain? Can you tell me?
Yeah, right over here on my right side.
Right side of your stomach?
Yeah.
Okay, like the lower part? Or?
Yeah,
okay.
lower part.
And how long have you been having that pain?
Since yesterday.
Since yesterday, before the surgery?
Yeah.
Okay. And is there anything that makes the pain worse or that makes it better for you?
Sitting up and moving around, like you see my stomach hurts.
Mm-hmm.
And then it's better like if I kind of press on it a little, or with an ice pack, or the pain medication they gave me helped as well.
Okay, and then can you explain what the pain feels like to you? Like dull, sharp, pulsing, or?
It's just kind of like a dull, aching pain right now.
Okay, and then you said they gave you medications. Was that helpful to manage the pain?
Yeah, it was, but I think it's worn off now.
Okay, so we can definitely check on the order for you for that. And now that I've done my pain assessment and my vitals, now I can listen to your heart and your lungs. Do you have any history of chest pain or palpitations, any heart murmurs,
No.
heart conditions, cardiac medications,
No.
chest tightness, breathing difficulty, dizziness, lightheadedness, any
No.
cough or smoking,
No.
respiratory infections or disease?
No.
Okay. Okay, so I'm going to start just by listening to your heart. So I'm going to start on the right side at the sternal border for the aortic valve. And then on the left side, the second intercostal space. And then the left side, I'm going to go to the second intercostal space of the sternal border for the pulmonic valve. And then I have Erb's point at the third intercostal space of the sternal border. And then at the fourth intercostal space, I have the tricuspid valve, the sternal border. And if you could use this hand to lift your breast tissue, I'm going to listen to the mitral valve at the fifth intercostal space and the midclavicular line. And here I'm just listening for any additional heart sounds, but with this patient I just heard S1, S2 sounds. And now I can also listen to the lungs one here. So I'm going to start at the right and left upper lungs at the second intercostal space and the midclavicular line. And second intercostal space, midclavicular line. And then for the right and left middle lung, I'm going to be at the second intercostal space and the midclavicular line. On the same, for the right and middle lungs, right and left middle lung. And then for the right and left lower lungs, I'm going to find half the arm length and the anterior axillary line. And same thing on this side, half the arm length and the anterior axillary line. And I'm just noting that the patient is breathing clearly. I don't hear any wheezing or crackling. And I'm also looking at chest movement and skin tone, and that it feels warm, and I can check skin turgor as well. And my patient's skin tone is even. And then, are you able to turn on to your side?
Yeah.
Okay, so I'm gonna listen to your lungs in the back, and I'm also gonna just look for pressure ulcers. So for pressure ulcers, I wanna make sure to check the occipital region, the shoulders, scapula, the vertebrae, the coccyx, sacral region, the knees, and then the ankles. And I don't see any redness, and I'm also checking the elbows. So same thing, I'm going to listen to the lungs here. So I'm going to start at the lower regions of the lungs. I'm going to start at half the arm length and along the vertebral line on the right side. And on the left side, half the arm length and the vertebral line. I'm going to find the posterior axillary line, and then I'm back on the right side. I'm going to go to the posterior axillary line, and then for the right and left middle lung, I'm going to go to the middle inner scapula and the vertebral line, and on the left side as well for the middle lung, and then for the right and left upper lung, I'm going to find the top inner middle scapular line, along the vertebral line, and then on the right side as well, same region. Okay, you can go ahead and go back on your back. And so my patient was breathing clear. I still didn't hear any wheezing or crackling. And now I'm just gonna touch your arms. So do you feel my hands?
Yes.
Okay. Any numbness, pain, or tingling?
No.
Okay, and my patient feels warm. I don't see any puffiness, which might indicate edema. And then I'm gonna check the radial pulses, and the skin tone is even as well. Those pulses are 3+. And then I'm gonna have you just squeeze my fingers, and then you can push against me and pull me. Okay, and then can I just check your capillary refill? And I wanna make sure that capillary refill is about less than 3 seconds. And then on your legs as well, I'm gonna go ahead and touch you. So do you feel my hands?
Mhm.
Okay. Any numbness, pain, or tingling?
No.
Okay. And then my patient feels warm. There's no puffiness, which may indicate edema. And then the skin tone is even, normal for ethnicity. And I'm checking the posterior tibialis pulses, that they're 3+. And then the dorsalis pedis pulses are 3+ as well, and equal for both. Capillary refill, want to make sure it's less than 3 seconds. And then you're gonna push against my hands, pull back against my hands, and then I'm gonna have you lift your knees to your chest. Are you able to do that on your own, or would you want to help?
I think I can do
Okay, so one leg at a time if you start with that one. Okay, any difficulty doing that?
it. No.
Okay, any joint stiffness or pain?
No.
Do you use any ambulatory devices?
No.
Okay, and any joint stiffness in your arms either?
No.
Okay, and then now I just want to make sure to do the abdominal assessment. So with the abdominal assessment, first I'm just exposing the abdomen, and I'm gonna look at the incision site. I'm looking for any redness, any swelling, any drainage, what type of drainage. So if there's any purulent drainage, serosanguinous drainage, if there's signs of bleeding or any signs of distension. And then I want to make sure to listen before I touch that abdomen. So I'm going to start at the right lower quadrant, and each quadrant I'm going to listen for about 15 seconds. And I want to hear 5 to 7 vowel sounds. And then the right upper quadrant, left upper quadrant, left lower quadrant, and vowel sounds were normal active. And with patients with abdominal surgery, though, it can be common to have hypoactive vowel sounds near the surgical site. And then I also want to palpate the abdomen. So I'm going to touch your abdomen, and you just tell me if you're feeling worsening pain in any of the sites, okay? Right here.
Hurts a little there.
Okay, and here.
Not as bad, no.
Okay, here.
No.
And here.
No.
Okay, here.
No.
Here.
No.
Okay, so just on the abdominal, on the surgical site, it hurts a little bit when I touch?
Yeah.
Okay, and I'll continue to monitor that for signs and symptoms of infection or bleeding. And do you have any reason, like, for me to inspect your genital region, like any discharge, any itchiness, pain with urination?
No.
Okay, and when was your last bowel movement?
Before the surgery.
Okay, was it normal for you? Like, was it soft form, hard?
It was soft.
Watery?
It was a normal bowel movement.
Okay, and have you had any nausea or vomiting?
No, not since the surgery.
Okay, have you been able to pass gas?
Yes.
Okay, and any like indigestion or change in appetite for you?
No, I haven't really been hungry since the
Okay.
surgery, so
No like signs of bleeding in your stool either?
no.
Okay, good. Okay. And then also I wanted to ask you, how are you feeling about being in the hospital?
It's okay. I mean, I want to go home soon. You know, I want to just be better already.
Yeah. We'll try to get you out of here as soon as we can. Do you have anybody that is going to come visit you, or that you're going to go home with?
My sister's gonna come pick me up when I'm ready.
Okay, good. And do you feel safe at home?
Yeah.
Okay, and you have is your sister going to help you too at home?
Yeah,
With
she's
your
gonna help take care
recovery?
of me the first day.
Okay, good. Okay, so is there anything else that you need? Here's your call light.
Thank you. I think I'm okay for right now.
Okay. All right, thank you so much. I'm gonna go ahead and make sure to lower the bed and give my patient their call light and just document my assessment. Cool. Did I do good?
I think so.
Okay.